Incontinence of urine is not an uncommon problem. Unfortunately, incontinence of urine is missed out many a times by everybody, by doctors, by society, by men, women, and they continue to live in agony and disgust and a lot of despair as to what to do. Now, today we are discussing on the topic of male stress incontinence. Now, stress incontinence or leakage of urine while walking, running, jumping, laughing, coughing sadly is known to women in the prime of life because of pelvic floor turning weak, because of multiple childbirths, because of age-related menopausal changes in the pelvic floor. And all this is treatable and curable. And at the Kokilaben Dhirubhai Ambani Hospital, we endeavor to look at women who have got incontinence of urine as a result of coughing, running, jumping, laughing, otherwise called as stress urinary incontinence, where they have to wear diapers. And women in their elderly age group, women in the middle age group, women post pregnancy, sadly, with cross incontinence, live with diapers. Unfortunately, the awareness on this subject is missing. And that's where many of them continue to live on diapers, live wet, while they're completely treatable by a mid-urethral sling or by the kind of support systems we create for the pelvis in women. Friends, male stress urinary incontinence or incontinence of urine as a result of prostate surgery, either it's a PURP, a prostate enucleation for a benign disease, or post radical prostatectomy, either by robotic route or by open route, where men in the prime of life picked up for prostate diseases, benign or cancerous, have been operated. And post operatively, they continue to leak urine. The leakage of urine is such that for weeks, months, and even years, people are leaking urine and there has been no answers. So today, the endeavor for all of you, you listen to this, is important for us to wake up to phenomena of middle-aged and elderly men who continue to live with leakage of urine. And that's not right. Leakage of urine, multiple diapers every day, having skin issues, living in a lower morale, and waiting for things to dry up, and attempts being made on various medications. If does not work, it is an iatrogenic urinary incontinence. The pelvic floor can turn weak. The radical prostatectomy by the robotic route or by open route was done to clear the prostate cancer. In majority of patient, continence improves, and when I do radical robotic prostatectomy back at the Kokilaben Hospital for cancer prostates, we look at the hood sparing technique, the Rocco stitches, the elevation technique, looking at all that, which on one side, after having removed the entire cancer, brings about a control mechanism over the next few days to few weeks and maximum few months. For individuals who continue to leak urine for months to years, there's a treatment available. And why not avail the treatment? So, male stress incontinence or leakage of urine after prostate surgery, which has lasted anything between 6 months to 1 year already, and year after year living on diapers, the treatment is available. And therefore, all of you who hear this today, you happen to be ambassadors on the subject for all men living in agony in India who could actually be treated and cured. It's just that we need to reach the society. We need to reach individuals and men who wanted a treatment for a disease which was taken up well by his urologist. But sadly, there are changes which have happened in the urinary incontinence rates, and that has not let him dry. He may be disease free, but he has got an add on unfortunate mechanism to the pelvis where the urine leaks out. Friends, today, adjustable urinary sphincters available are something which we do here at the Kokilaben Hospital, where we, using an adjustable urethral sphincter, will be able to bring about a control where, with the right kind of pressure management, can be done by the male patient who knows how to control the sphincter. So you're not leaking anymore in diapers or undergarments or before you reach the washroom. You have got a control mechanism which is implanted by us. And that control mechanism called the artificial urinary sphincter very much brings you back to life. You're back on streets, you're back to work, you're back in your life after having lived in agony for a short while, which could even be months or years. So why not utilize this effort of identifying colleagues in the society who could be your relatives, who could be your neighbors, or could be somebody who's leaking urine after prostate surgery. So if you're leaking urine after a prostate surgery and there's already been 6 months to 1 year and there's no respite and you continue to live with leakage of urine that requires diapers multiples a day, I think it's time for us to assess you, reassess you, and treat and cure you. Of the patients who have undergone this treatment, feels good that they are dry and they continue to be dry. So why not utilize the effort of utilizing the urologist's aspect of care where you would have artificial urinary sphincter bringing about a sphincteric control or leakage of urine abolished, and therefore the agony abolished from this. This is a complex undertaking and something which I undertake more frequently in prostatic urology for individuals who live in agony on various aspects that is not being the state of art for body has to be taken forward. So friends, male incontinence, which is an iatrogenic sequence happening after prostate surgery, is curable. Both benign prostates by TURP, by holmium laser therapy, post surgery, some leakage temporary, leakage mild, controlled is great. But those leakages which lead to diapers, those leakages which are significant, where months and years later you still are leaking urine in any part of the country, I think it's a wake up call that we wake up to a phenomenon that it is treatable and curable. So why live with the agony of diapers at all? Friends, the adjustable sphincter available today is a state of art technique created over generations of modification by engineers. And today we are in a situation where we would be able to give you dryness after a prostate cancer surgeries, incontinence of urine, which uh, perhaps did not get cured on its own, where the muscles could not get activated to a point in time, where the sphincteric weakness has resulted as a result of a weak sphincter in a middle-aged and elderly man, where a cancer prostate has been scooped out completely, or the prostate has been scooped out. So don't live in agony and disgust. Get this sorted and treated and cured for yourself and for everybody who lives with male urinary incontinence, leakage of urine, at the Kokilaben Dhirubhai Ambani Hospital in the Department of Urology. I'd be keen to take care and help individuals out. Thank you so much.